Hi, I'm Dr. Alper Gökçe, your orthopedic surgeon and hand specialist in Turkey. Today I want to talk on degenerations on small joints, especially on them located at hand. You probably have heard of hip replacements, but did you know that you have small joints replacement for your hand and wrist? Small joint replacement surgery is a procedure in which bone and structures that line the joint are removed and replaced with new parts, new implants. This procedure is necessary when the articular cartilage, the substance on the surface of a bone, wears out or is damaged, which means the bones will no longer glide smoothly against one another. It may also cause deformity and loss of functions. What is the causes? Normally, bones have a smooth surface covered with a substance called articular cartilage on their ends that allows one bone glide easily against another. Joints are lubricated by a thin layer of fluid, synovial fluid, that acts like an oil in an engine to keep parts gliding smoothly. When the articular cartilage wears out, is damaged, or the joint fluid is abnormal, problems develop, and joints often become stiff and painful. This is arthritis, which may be possible to treat with these procedures. Of course, after every effort of conservative treatment methods, we have to make surgeries. New surgical techniques to treat problems previously felt untreatable were now in practice. The concept of joint arthroplasty, already well established during last decades, became a useful tool in algorithmic option for management of the sequelae of degenerative joint disease and rheumatoid arthritis. I show here a picture taken from Stryker company, which shows in general their alternative products for every location for giving a clue. Historically, resection with interposition arthroplasty became the focus of attention at the dawn before attempts to replace joints in form and function. Autogenous materials such as adipose and skin and prosthetic materials such as wood, rubber, glass, gold, aluminum and platinum were used as a spacer to prevent bone healing in the past. Efforts taken to find an ideal technique and biomaterial dates back more than a century ago. Today, we have a variety of materials like types of metals and their alloys, ceramics, silicone, etc. on the market. These materials are preferred for replacing the joints. Reducing joint pain, restoring or maintaining joint motion, improving the look and alignment of the joint, improving overall hand function is our goals in treatment. Artificial arthroplasty gives us all at the same time. However, interposition arthroplasty gives some of them in a limited version. Let us look at the pathologies we often meet in clinics. I'm going to try to explain them in order from proximally to distally locations at the hand. The first location is the wrist joint. The wrist joint actually consisted of two different joints, or is a combination of two joints, distal radioulnar joint, DRUJ, and radiocarpal joint. The first joint, distal radioulnar joint, is separated from the wrist with a triangular shaped fibrocartilage complex with the name triangular fibrocartilage complex, TFCC. This well-developed structure is also an extension of the radial joint surface. At the same time, when one or both of these joints get degenerated severely, then surgery becomes an alternative treatment option. Besides the prosthetic arthroplasties, biologic arthroplasty alternatives of surgical techniques are also available. Depending on the etiology or the disease, that causes degeneration at the joint, surgical alternatives may vary. Inflammatory disease like infections or rheumatoid ones are treated with artificial joint replacements best after their active stages are over because they usually affect all compartments of the joints. Disease like ulnar abutment or Kienbeck disease or Preiser disease or post-traumatic partial joint damage usually get treated with limited osteotomies or soft tissue interpositions or fusions. Please watch our previous videos in this channel. Carpometacarpal joint is the second station. This joint is located at the base of the thumb. It has a very high range of joint motion and high stress act on it. Furthermore, ligamentous support lacks in some parts of the motion interval degree that accelerate the degeneration. This joint is important in hand function, especially in gripping things powerfully. Musicians, sportsmen, labor workers, or even housewives need the function of this key joint at any time during their activity. Deformity, pain, and function loss are seen in clinics. Besides the implanted arthroplasty, we also obtained successful results with recently developed arthroscopic debridement and soft tissue reconstruction techniques, particularly at this joint. This technique is minimally invasive and has several other benefits in fast return back to daily life. Interphalangeal joints of the interphalangeal area are also important in hand activity. They usually are degenerated as a final stage of rheumatoid inflammations or post-traumatic sequelae or genetic disorders. Genetic idiopathic disorders are seen especially at the distal interphalangeal joints with coexistent nodules of Eberden located at the distal interphalangeal joint at the elderly women especially. Separated joint surface replacements or constrained hinge types of prostheses are indicated for patients whom collateral ligamentous stability have lost. And now shortly for hand physiotherapy. None of these advances would have been possible without concomitant advances in hand therapy. Hand and wrist surgery, unlike some other areas of orthopedics, reconstruction is labor intensive. Surgery on the hand and wrist often requires immense effort from both the patient and a skilled hand therapist. The ultimate success of small joint arthroplasty has undoubtedly been made possible by the contributions made by skilled hand therapists. Their knowledge of wound healing, the influence of scar and control stress on tissues, mobilization techniques, and the use of custom splinting have made the therapist a crucial member of the treatment team. These procedures have risks, which I am going to list now. Implant loosening, fracturing or wearing down over time, which may require subsequent surgery, infection, joint stiffness or pain if the procedure or implant fails, dislocation of the artificial joint, damage to vessels, nerves, or other structures in the region of the surgery. If you have any type of small joint disorders which is intractable with classic treatment alternatives like splinting, medicines, etc., then call us. Thank you for watching.